If you have ever wondered whether there is a real medical solution to help delay ejaculation, or whether the promises you see online are just clever marketing, you are not alone. And today, we're going to walk through the truth together in a clear, calm, and practical way. As men get older, many begin to notice changes in stamina, sensitivity, and control, and it can feel confusing or even frustrating when your body does not respond the way it once did. The good news is that science has studied this issue extensively, and there are legitimate medications that can help, but not all options work the same way, and not every solution is right for every man. Premature ejaculation is often linked to heightened penile sensitivity, neurotransmitter imbalances in the brain, especially serotonin, or anxiety-driven arousal patterns, and understanding the mechanism behind it is the first step toward choosing the right approach. One of the most common medical options includes topical anesthetic sprays or creams that contain lidocaine or prilocaine, which temporarily reduce nerve sensitivity on the surface of the penis. These products work by slightly numbing the skin, slowing down the nerve signals that trigger climax, and clinical studies show that they can significantly increase intravaginal ejaculatory latency time when used properly. However, while they are effective for many men, they must be applied carefully and wiped off before intercourse to prevent transferring numbness to a partner, and they do not address psychological or neurological causes. Another well-researched category involves selective serotonin reuptake inhibitors, commonly known as SSRIs, which were originally developed as antidepressants, but have a side effect of delaying ejaculation. Medications such as paroxetine, sertraline, and fluoxetine increase serotonin levels in the brain, and higher serotonin activity is associated with delayed climax. Research shows that certain SSRIs can multiply ejaculation time several times over baseline levels, but they require daily use and may take 1 to 2 weeks to show full effectiveness. Some men experience side effects such as mild nausea, fatigue, or reduced libido, so medical supervision is important. A shorter-acting SSRI called dapaoxetine was specifically designed for on-demand use in some countries, although availability varies depending on location. Experts like Dr. Mohit Khera often emphasize that understanding your individual pattern, whether it is lifelong, acquired, psychological, or sensitivity-based, determines which medical strategy may be most beneficial. The key takeaway at this stage is that medications can work, and many are supported by solid clinical research, but they function through different biological pathways, and choosing wisely requires knowledge rather than impulse decisions. Now here is where many men become surprised, because medication alone is not always the full answer, and understanding what works versus what does not requires looking deeper into how your brain and body communicate during intimacy. While topical sprays reduce surface sensitivity and SSRIs modify serotonin pathways in the brain, there are additional medical approaches that are sometimes discussed, including tramadol and certain phosphodiesterase type 5 inhibitors, yet these options require careful consideration. Tramadol, originally developed as a pain medication, has been shown in some clinical studies to delay ejaculation because it influences both opioid receptors and serotonin reuptake. But it carries a risk of dependence and side effects, such as dizziness, nausea, and potential withdrawal symptoms, which means it is generally not considered a first-line treatment. Phosphodiesterase type 5 inhibitors, like sildenafil, commonly used for erectile dysfunction, do not directly delay ejaculation, but in men who experience performance anxiety or mild erectile instability, improving erection confidence can indirectly increase control and prolong time. This is where the conversation becomes more nuanced, because what feels like a physical stamina issue may partly be an anxiety loop, where fear of finishing quickly actually accelerates the process. Suspense often builds when a man tries one solution after another without success, wondering why nothing seems to fully solve the problem, and the answer frequently lies in combining medical science with behavioral strategy. Research consistently shows that pelvic floor muscle training, particularly strengthening the bulbocavernosus muscle, can improve ejaculatory control over time. In addition, structured techniques such as the stop-start method and controlled breathing patterns can retrain the nervous system's response to arousal. These are not quick fixes, but when paired with medication, they can significantly improve outcomes. Dr. Mohit Khera often highlights that sexual performance is not isolated to one organ, but represents an integration of neurological signaling, vascular health, hormone balance, and psychological stability. Testosterone levels, sleep quality, cardiovascular fitness, and metabolic health all influence sexual endurance. Men who neglect exercise, carry excess abdominal weight, or suffer from chronic stress often experience heightened sympathetic nervous system activation, which accelerates climax. In contrast, consistent physical activity improves nitric oxide production, supports healthy circulation, and enhances overall stamina. Adequate sleep regulates dopamine and serotonin balance, which directly impacts arousal control. As you begin to see the bigger picture, you may realize that the true solution is rarely a single pill, but rather a tailored plan based on your unique physiology and lifestyle. The real question is not simply which medication works, but which combination of medical therapy, lifestyle adjustment, and psychological awareness will work best for you, and that realization changes everything. At this point, the most empowering realization is that you are not powerless, and the decision about how to approach delayed ejaculation treatment should be thoughtful, informed, and personalized rather than rushed or driven by embarrassment. Science clearly shows that topical anesthetics can be highly effective for men whose primary issue is penile hypersensitivity, while SSRIs offer a neurologically based solution for those whose serotonin regulation plays a central role. Yet neither option is universally perfect, and both require realistic expectations. Medications can improve timing, but they do not automatically build confidence, deepen emotional connection, or correct unhealthy lifestyle patterns that may silently undermine performance. This is why long-term success often depends on stepping back and evaluating your overall health profile. Cardiovascular fitness directly influences blood flow and nerve function, and strong circulation supports sustained arousal control. A diet rich in leafy greens, healthy fats, lean proteins, and antioxidant-dense fruits improves endothelial health and reduces inflammation, which benefits sexual function at a cellular level. Reducing alcohol intake is also critical, because while alcohol may temporarily reduce anxiety, it disrupts nerve signaling and can create inconsistent performance patterns over time. Chronic stress elevates cortisol, and elevated cortisol interferes with testosterone balance and increases sympathetic nervous system activity, pushing the body toward rapid climax rather than controlled response. Simple daily practices, such as slow diaphragmatic breathing, strength training, moderate cardiovascular exercise, and maintaining consistent sleep schedules, regulate neurotransmitters that influence ejaculation timing. When men approach this topic with curiosity instead of shame, progress becomes possible. Dr. Mohit Khera often reminds audiences that sexual health reflects overall health, and viewing it through a medical and lifestyle lens removes stigma while restoring control. It is also important to consult a qualified healthcare provider before starting any medication, especially if you have underlying medical conditions or take other prescriptions, because safety must always come first. Some men may require dose adjustments, alternative therapies, or combined approaches, and professional guidance ensures that you avoid unnecessary risks. As you reflect on everything discussed, understand that improvement is rarely instant, but steady, consistent effort, guided by science, produces measurable change. The goal is not perfection, but progress and confidence built through knowledge. When you align medical treatment with healthy living, stress management, and realistic expectations, you create a powerful foundation for lasting sexual well-being and vitality. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.